Well, good evening once again. Day 1216 of this Trump administration. 168 days until the presidential election. Less than 6 months until Trump faces off with the presumptive nominee of the Democratic Party, Joe Biden. Right now, Trump is wrestling with a health crisis that is nowhere near under control, one that has left our economy in shambles. Tonight, our nation's death toll stands at 92,566. The number of confirmed cases in this country now north of 1.5 million. Yet today, the president had this take on the numbers. While we may lead the world in deaths and coronavirus cases, the latter is a kind of badge of honor.
So if you're testing 14 million people, you're going to find many more cases. Many of these people aren't very sick, but they still go down as a case. So actually, the number of cases, and we're also a much bigger country than most. So when we have a lot of cases, I don't look at that as a bad thing. I look at that as, in a certain respect, as being a good thing, because it means our testing is much better. So if we were testing 1 million people instead of 14 million people, we would have far fewer cases, right? So I view it as a badge of honor. Really, it's a badge of honor. It's a great tribute to the testing and all of the work that a lot of professionals have done. Okay?
The president was also defending for a second day his decision to take the anti-malaria, anti-lupus drug hydroxychloroquine, despite warnings from his own government.
The FDA warned that hydroxychloroquine could cause serious side effects, especially with the heart.
Yeah. I've worked with doctors, and if you look at the one survey, the only bad survey, they were giving it to people that were in very bad shape. They were very old, almost dead. It was a Trump enemy statement.
Trump told reporters on Capitol Hill the drug gives you an additional level of safety, as he put it. Hours later, during a meeting with his cabinet, he doubled down on his explanation about the drug.
There was a false study done where they gave it to very sick people, extremely sick people, people that were ready to die. It was given by obviously not friends of the administration. And the study came out. I have a doctor in the White House. I said, what do you think? And it's just a line of defense. I'm just talking about as a line of defense. I'm dealing with a lot of people. Look at all the people in the room. You know, I'm the president, and I'm dealing with a lot of people. It's been out for close to 70 years for a couple of different things, right? Lupus and malaria and even arthritis, they say. But I think it's worth it as a line of defense, and I'll stay on it for a little while longer.
By the way, the study he's talking about at VA hospitals was partially funded by his government, by the NIH. While Trump continues to shrug off the research on the drug's effectiveness in treating the coronavirus, no large, rigorous studies have shown it to be effective in treating or preventing COVID-19. And the FDA had warned about off-label use of the drug, but today the agency's commissioner simply noted that, quote, the decision to take any drug is ultimately a decision between a patient and their doctor. Vice President Mike Pence, whose press secretary tested positive for the virus today, told Fox News he's not taking the drug. While the White House tries to keep this virus at bay, communities across our country are now emerging, ready or in some cases not, after a nearly 2-month shutdown. By tomorrow, all 50 states will have started lifting restrictions in some form or fashion. NBC News tonight confirming a new AP report that says Trump campaign allies are now recruiting pro-Trump doctors to publicly call for reviving the U.S. economy as quickly as possible without waiting to meet CDC guidelines for reopening. Trump was on Capitol Hill today for a luncheon with Senate Republicans billed as an event to discuss the response to the pandemic. Our colleagues report the gathering was largely focused on poll numbers, Joe Biden, and warning senators they need to toughen up or they'll lose in November. There were also said to be brief discussions of future relief bills, but senators who were there tell NBC News that wasn't the focus of the discussion. Later at the White House, when CBS News correspondent Paula Reed asked Trump about economic recovery, this was the response.
Mr. President, why haven't you announced a plan to get 36 million unemployed Americans back to work?
Oh, I think we've announced a plan. We're opening up our country. Just a rude person you are. We're opening up our country. We're opening it up very fast. The plan is that each state is opening, and it's opening up very effectively.
A lot of these jobs are not coming back.
Trump's Treasury Secretary Steve Mnuchin and Federal Reserve Chair Jay Powell did have to come up with responses about the economy during this morning's hearing before the Senate Banking Committee. Their predictions were dire. The questioning at times was heated.
We are continuing to see large unemployment and other negative indicators. There is the risk of permanent damage. And as I've said before, we're conscious of the health issues, and we want to do this in a balanced and safe way.
How many workers should give their lives to increase our GDP by 0.5%? That you're pushing people back into the workplace. There's been no national program to provide worker safety. The president says reopen slaughterhouses. Nothing about slowing the line down. Nothing about getting protective equipment. Is how many workers should give their lives to increase the GDP or the Dow Jones by 1,000 points?
You know, workers should give their lives to do that, Mr. Senator. And I think your characterization is unfair.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.